Hello everyone, this is Dr. Abhishek Banerjee from the Department of Oral Medicine and Radiology in BBDCODS, and I am here to discuss this topic, Sialography. Sialography can be defined as a radiographic demonstration of the major salivary glands by introducing a radio-opaque contrast media into the ductal system. It is very effective for diagnosis of obstruction, whether caused by a stone or stachers. Stachers means narrowing of the canal. Indications are to determine the presence and position of calculi or other blockages, to assess the extent of ductal or glandular destruction secondary to the obstruction, and to determine the extent of glandular breakdown. Contraindications are any allergic patients to compounds containing iodine, period of acute infection or inflammation, and when clinical examination or routine radiographs they show calculus near to the ductal opening, the injection may push the calculi back down into the main duct. The procedure is divided into three phases: preoperative phase, filling phase, and the emptying phase. First is the preoperative phase. This involves taking a preoperative radiograph before the contrast medium is introduced. It is done to note the position or presence of radiographic obstruction, assess the position of shadow of normal anatomical structures that overlie the gland such as the hard bone, and to access the exposure factors. Second is the filling phase. The duct orifice needs to be clinically probed and dilated and cannulated in this phase. See, in this the parotid gland and the submandibular gland is first. The clinical observation is done of the ductal orifice, then dilation is done of the ductal orifice, and finally cannulation is done of the ductal orifice. The contrast medium can be introduced in this phase, and then three main techniques are available for introducing the contrast medium. I will tell the techniques later. Then the emptying phase. The cannula is removed in this phase and the patient is allowed to rinse out. There is use of lemon juice at this stage for excretion of the contrast medium. After 1 to 5 minutes, the emptying phase, the post-operative radiograph is taken, usually oblique lateral is taken. This film can be used to crude assessment of function. If any amount of contrast medium is left after the post-operative radiograph, then sialographs are given. The three main techniques available for introducing the contrast medium are simple injection technique, hydrostatic technique, and the continuous infusion of pressure monitored. In simple injection technique, oil-based or aqueous medium is introduced by gentle hand pressure until the patient experiences tightness or discomfort. 0.1 ml is given for parotid gland and 0.8 ml for submandibular gland. Hydrostatic pressure. Aqueous contrast medium is allowed to flow freely from an overhead reservoir into the gland under the force of gravity until the patient experiences discomfort. In continuous infusion pressure monitored method, a constant flow rate is adopted and the ductal pressure monitored throughout the procedure. Contrast medium used are all iodine based. They can be ionic aqueous solution, non-ionic aqueous solution, oil based solution, or water insoluble organic iodine. Most of the departments aqueous solutions are used. There are basic advantages and disadvantages of both oil based and aqueous based. Oil based advantages: it is densely opaque, so the contrast is very good, and it is highly viscous, so it remains for a long time in the gland. Disadvantages is the contrast remain for many months in the soft tissue and may cause foreign body reaction, and due to its high viscosity it can sometimes push the calculi inside the ductal system. Aqueous solution, it has low viscosity, so it can be easily removed from the gland and easily absorbed and excreted. Because of its disadvantages, less radiopaque, so it sometimes the line duct systems cannot be easily assessed, and excretion is rapid from the ductal system. Sialographic interpretation. Firstly, the normal sialographic appearances of the parotid gland. For the parotid gland, tree in winter appearance is seen. For submandibular gland, bush in winter appearance is seen. Now the pathological appearances. Sialographic appearances of cannula include filling defect in the main duct, ductal dilation proximal to the calculus, and emptying film usually shows contrast media remained behind the stone. These are the radiographs showing ductal system, and post-operative radiographs showing stones. Sialographic appearance of Sjogren syndrome. It shows a snow storm appearance. Intrinsic tumor. Sialograph of a right parotid showing a large area of underfilling in the lower lobe caused by the intrinsic tumor. Thank you.